Okay, thank you. I think we're going to go on ahead and get started. We'd like to begin this event with a tribal land acknowledgement, because although we're not all gathered together physically today, we believe it's important to acknowledge that the YWCA Spokane resides on traditional homelands of the Spokane people and other Indigenous peoples who are connected to this region. You can text the number visible on the screen to learn which Native territories you are occupying wherever you are in the United States. We wish to recognize the Indigenous people who have been dispossessed and displaced from their ancestral and spiritual homes and the taking of their land through colonization. We recognize that land acknowledgement is only a first step towards honoring the contributions of Native Americans and Indigenous peoples today, and we continue to strive towards policies and practices that bring about justice and reconciliation. We respect and honor the first people of this land, past and present, on which we advocate, work, and live. I'd also like to take a moment to thank our mission partners, Providence Healthcare, Multicare, Numerica Credit Union, Kalispell Tribe, and Northern Quest Casino and Resort and Hamilton Studio, without whom this event and so much of our organization's work would not be possible. Thank you also to our 2001 Freedom Partners, Northwest Farm Credit Services, Garco Construction, and Inland Imaging, and our July Pathways Forward event sponsor, Horizon Credit Union. If you would like to join our partners in supporting the work and the mission of the YWCA at any time during this webinar, please consider clicking the link the link to donate that we've dropped in the chat, or contact our donor engagement coordinator to discuss opportunities for this kind of transformational giving. Finally, I'd like to thank all of our panelists and all of our viewers and participants out there for taking the time to be part of this important discussion. Someday we'd like to be able to have these kind of gatherings together, but right now this actually works really pretty well. We had a panelist discussion a few months ago. We talked about the she session, recession, and that was really well received, and appreciated everyone's feedback on that. And so today we're here to talk about a lot of the activities that we have going around and the trauma surrounding children and some of the information that our panelists that would like to share today. So I'd like to have them each introduce themselves briefly. So first of all, Toni, if I could start with you, just give us just kind of a brief a focus of your work and the passions related to this topic.
Hi, I'm Toni Lodge. I'm the CEO of the Native Project here in Spokane. Native is an urban Indian health and community health clinic that offers medical, dental, pharmacy, youth services, children's services, licensed behavioral health and mental health. I'm a citizen of the Turtle Mountain Chippewa tribe and a grandmother and mother. And I'm a member of this Washington State Governor Inslee's Safe Start Reopen Washington committee that has extensively looked at the needs of social services as we reopen Washington State after COVID, specifically in the areas of behavioral health and for children.
Thank you, Toni. Freda?
Hello, I'm Freda Gandy. I'm the Executive Director of the Martin Luther King Center here in Spokane. We are a nonprofit social service agency that provides a variety of social and educational programs to primarily low-income children, youth, and families in Spokane. I have been with the MLK Center for 21 years now.
Thank you, Freda. Hi, Joel. Would you please introduce yourself?
I'd be happy to. Good afternoon, everyone. I'm Joel Ryan. I'm the Executive Director of the Washington State Association of Headstart and ECEAP. We do two main things. We are advocates for high quality early education in Washington State. And we also advocate in DC as well on federal early learning policy. I've been doing this work for over 20 years now. I started as an AmeriCorps volunteer in the City Year program, and where I helped Head Start kids learn how to read. And that's how I got my start doing this work. I've always been really passionate about parent engagement. And so I'm happy to talk more about that, and I'm looking forward to the conversation this afternoon.
Thank you, Joel. Hi, Shannon. Would you please introduce yourself?
Hi, thanks for having me. I'm Shannon. I'm Griffiths, the director. I haven't done that one in a while, for the early assistant program for the YWCA, so ECEAP. And I also oversee the drop-in classroom, which is childcare for on-site services for all of our other programs: domestic violence, Women's Opportunity Center, our Sisters Closet, and ECEAP. I've been with the Y for 15 years, and I've been supporting and working with youth for over 20.
Thank you, Shannon. So this discussion is going to include 3 key parts. We're going to define the problem, we're going to be outlining some solutions, and then answering some of the questions that those of you that are participating may have on this topic in real time. So over the course of this conversation, as questions come up for you, if you will just please enter them in the little question and answer box at the bottom of your screen, so that way we can answer as many of those as we have time. Please also feel free to utilize the chat feature to throw out other thoughts and have some conversation, observations you may have, and communicate with your fellow attendees. When you send a chat out, please note that who you are sending it to. In our last event, we had a number of messages that were meant for everyone, but only went to the panelists. So look at your little drop down there and make sure that you're communicating to the person that you intend to, and that way we're able to see everyone's chats. So let's get started. As we know, this past year has been very tumultuous for everyone, and children and caregivers especially have experienced some extreme upheaval. It's been pretty difficult. I'm seeing in your responses in the opening poll that some of you have had some some firsthand experiences with this. Brianna, were we able to put the poll up? I am not seeing the poll. Here's the poll. Okay. Have you experienced the pandemic taking a toll on the mental health of children, youth, and caregivers in your life? Okay, I'm going to give everyone a little bit of time to respond to the poll. Okay, now I'm going to ask Brianna to tell me what the poll is saying, because I cannot access that. Oh, 95% yes. Wow. Yeah, we're all shaking our heads. None of us are surprised to see that. All right, so I'd like to give the panelists a chance to respond to some of their experiences and dive in a little deeper into the topic to help us understand the kind of situation we're looking at and what we really mean when we call this situation, this experience, trauma. So I'm just going to start and kind of go around and ask each one of the panelists this question. So Freda, you're in my left-hand corner, so I'm going to ask you first. Can you speak to what you've been seeing and experiencing with kids, families, and child care providers in your work and your communities as far as the toll this past year has taken?
Well, when the pandemic hit, just like so many other nonprofits, we had to modify what services were going to look like and how, as a social service agency, we were going to provide those services and also make sure that we were being safe. We were doing our best to keep the community as a whole safe as well. So that meant when school-age kids couldn't go to school, providing a place for them to come and access the internet and receive academic support from staff that worked here at the center. Also, we saw a high need in people needing access to food. So offering our food bank and making sure that when parents or the community as a whole needed food, we were here to provide that. Also making sure that families had access to rental and utilities assistance. So these were a lot of the needs that we saw before the pandemic hit. They were just amplified, when COVID became, the center of the world at that point. So we did what we could in terms of providing services that were an immediate need for families, while also making sure that everyone, including staff, remained safe at the same time. So we have seen the stress of parents who were already struggling before the pandemic hit. We saw kids who were confused, didn't really understand why they were learning remotely. At 6, 7, you don't understand why you need a mask, or even at 3, or what is really happening. So that stress and that trauma became even more real for them. And as an organization, we had to figure out how to provide those different types of supports for different types of families in the community who was experiencing COVID in many different ways, because it was affecting families differently.
Sure.
There was no one size fits all. We had parents that couldn't work. We had parents that could work and needed childcare. We had parents that had access to food. We had parents that didn't. We had parents who could pay rent and who couldn't. We had parents who could, pay utilities, and those that didn't. So it was figuring out a way to meet the various needs of so many different families in the community for us as an organization and as a staff, and also remain safe and go home to our families at the end of the day.
Yeah, the impact on the caregiver. Shannon, can you share with us your experience?
Yeah, it was very similar to what Freda just talked about. I think what I would just emphasize is the isolation and the balance for our staff who are in this field. I think the first question we had is to open or not to open. And we decided to open in August, and we remained open the whole year. And that worked in our favor with all the precautions that we took, but there was just more amplified balance, trying to find that balance, how to support your employees who are simultaneously going through an experience where their children are home, they're trying to find childcare, they're trying to maintain the well-being, the mental health aspect of that isolation. Every story was different. And what I would also say about the trauma is this was a collective trauma for us. Everyone was experiencing it, but not everyone was traumatized, right? So some people, like Freda emphasized, especially with our staff or our team and the families we serve, they fared very well. And it was an opportunity for them to strengthen parts of their routines and rituals and connection. And then others, couldn't maintain. And I think when we have those co-occurring experiences, we're already struggling with addiction or mental health or poverty. That's where it becomes really complex. And this is primarily our world in early education or in ECEAP, because the qualifying factor is that you're at 110% of the poverty level or below. I mean, you're already having a trauma experience. So, we're resourced in that way, and we're structured to support that already. But I think the emphasis of the trauma-informed lens for me was, how do we put our employees first? For the first time, I had to start asking that question. not that I came up with a, miraculous answer, but we were able to find ways to, simple ways to do that. And I think that made a big difference too in the system. So very similar experience to Freda though.
Thank you. Joel, can you share with us some of your thoughts?
Sure. Yeah, I'm just kind of listening too. It's interesting what people are, and I've worked with Shannon for a number of years, so it's interesting to get her perspective on it. I mean, I think one thing I would say that I think is a question I would sort of pose, maybe rhetorically, but also to get perspective from people, is that, did the COVID-19 pandemic cause a mental health crisis or reveal one, or potentially accelerate one, right? And I think that's going to be a question policymakers are thinking about. We did a survey at our Association of Headstart and ECEAP contractors, and we asked them, are you seeing greater mental health challenges for families? And there was at least an increase of 20% to 25% of families experiencing more trauma. I think that's true. Let me also say a couple of things too. I think building on what Shannon said, this has elevated the need to make sure we're caring for people who care for kids and families, and put a spotlight on that. It's really remarkable. I work on the policy end of it, right? So I'm not doing the work, but I think policymakers are now hearing the heroic actions of people at the Y, people who are in early learning, people who are in child serving or family serving social services, the work that was done across our state and even our country to support families, and also the toll that takes on the people who are doing that work, I would say. I think the other thing I'll just hold up, and I'm trying to find things that are bright spots in a really terrible sea of trouble, right? I think the public schools shifted a little bit from this experience, right? Because I think, programs like Headstart and probably many of the panelists who work in this field, we've always focused on trauma and the importance of mental health. And I think the public schools are trying to shift that way due to the pandemic. It's not something that was their main focus. And you're seeing policymakers really push this. Now, whether or not pushing means that there are real dollars, that people who are using Medicaid funds actually there's a reimbursement rate high enough so people can actually attend a doctor or find a therapist, or and we'll see if it translates into real positive action. But I would say the positive part of this is just that it's elevated the issue that probably just was revealed again, right? It sort of highlighted that. I'd say the other thing, I'll give you my quick observation too before I want to make sure the other panelists get a chance to speak. But my daughter's doing a theater camp, so last night I was waiting for her to pick her up, and I was just listening to sports radio. I'm a big sports fan. I won't tell you the teams because it'll get everybody upset. But a number of guys called into the sports radio saying they support Simone Biles and her position around mental health, and that she said, I'm going to take a step back. I don't know if you would have heard that 5 years ago. Yeah, having middle-aged white guys call up a sports radio station and say, that makes sense to me, what she's saying. And so I think, this issue, even this morning I was watching SportsCenter, they were arguing about this again, as they're always trying to find something to argue about. And the vast majority of the commentators were in favor of providing more support and highlighting mental health as an issue. So it may be that the COVID-19 pandemic has revealed something and also accelerated some bad things, but maybe some of the good things is that it's highlighted the need and importance to focus on children's mental health and adult mental health as well.
Well, thank you, Joel. And thank you for sharing that story. Toni, can you speak to what your organization has been experiencing? I know that you don't necessarily have any direct childcare services that you're providing, but I know that your community, you're very connected with the children there.
Well, we actually do have a lot of specific child serving programs, but I just want to say, the first COVID case, everyone's going to get tired of me saying this, in Spokane County was a Native woman with her children living in a little apartment, and that was on March 11th of this year. So that since that day, we have been dealing with the after effects of children and families in our community. One of the things that happened is after that day, we went from 100% in-person care as a medical and behavioral health facility to 60 to 80% telehealth. You cannot do well child medical care via telehealth. So for 18 months, or 15 to 18 months now, the children in our community are behind in their well child. In their other immunizations, not even talking about a COVID immunization, they're behind in their dental visits. They're behind in their developmental stage assessments, which you have to do really when you're weighing, measuring kids. It has to be in person. One of the things that we've seen, COVID has not been an equal opportunity destroyer. Some communities have been way more disproportionately affected. And for our kids who did not have computers in their homes, many of them did not have computers. Many of them did not have Wi-Fi. They did not have Comcast in their homes. We had to really scramble to reach an equitable level of access for our kids even to be able to do telehealth or telebehavioral health or teleschool. One of the things that we're seeing now, and we actually just had a meeting about this morning with our staff, is the level of anxiety and depression amongst our kids is overwhelming. I'm going to say it again, and people are going to get angry at me saying it over and over. Native Project is the only licensed behavioral health organization for BIPOC children in the city of Spokane, in Spokane County. And we have a thimbleful of service for gallons of need. And, I feel like there is this huge, overwhelming tsunami coming at us of need. Anxiety and depression. We actually did our summer youth program in person this summer. The kids have gained so much weight in a community that is rife with diabetes and other health issues. The kids have gained so much weight sitting around. It's kind of funny. I have a grandson who's in the first grade. It's been fascinating to watch him. He can only read when something's on the TV, on the screen. He cannot read a book. While he's in the first grade, he learned how to read on the Zoom. And I thought, yep, brain conditioning. And so we're going to have a lot of educational issues that we're going to have to address as we move forward. The other thing I think that has been interesting to me is that we have literally been incubating trauma. We know what trauma is in the Native community. You've read about the residential schools, the deaths, we've had smallpox. My grandma used to tell me a story. She went to bed in the early 1900s in bed with her sister, who was 1 year younger than her, woke up in the morning. Her sister had passed away in the night. They were 10 and 11 years old from influenza. And when she died, when she was 86 years old, she still told that story of her sister dying, passing away in bed with her. And that trauma lasted her whole life. So we're going to have to figure out a way to unpack this for this incubated generation of kids experiencing trauma. So I'll be quiet now and someone else can talk.
Wow. Thank you, Toni. I really appreciate your sharing that perspective with us. So we kind of rumbled a little bit here with some of the issues that we're looking at, some of the problems, but one of our goals always with Pathways Forward in this particular series is to focus on generating conversations that are solution-minded. And I believe that we can all make a difference in our community if we approach some of the problems with this mindset. So this portion of the panel discussion, we'd like to have some progress-minded kind of questions we had some that were submitted online. And we'd also encourage you to continue to submit your questions in the question and answer box at the bottom of your screen. And we'll be answering some of those questions soon. So please feel free to put those in. So the question that I have right here is there anything that you've learned from this experience this year that will change how you will approach or think about childcare or children's mental health in the future? So is there anything specific that you can think about and how you will react differently in the work that you're doing? So Shannon, I'm going to start with you on that if you can.
Yeah, thanks. I'm just going to reiterate putting our staff first and hopefully advocating and continuing to work around policies and practices that support alternative options. You know, when we have a team who their core work is on connection and building relationship, it's a lot of the work that we do with our early education program is we use a social emotional program called Conscious Discipline, and it's all about community, right? Building that school family, building the individual connection, and then teaching those self-regulation skills and self-soothing skills, that emotional intelligence. But then when we have our staff or our team who are having their own challenges and need time off or they're ill, we hustle to bring somebody into that environment that doesn't have that connection and or training and education. So just working on allowing there to be a system that puts our, employees first. And then also a number of our staff that are drawn to this work have high adverse childhood experiences or traumas already, right? And so then we have this high expectation that somebody who has this background in trauma is addressing somebody with trauma. So working on not re-traumatizing the staff and or the families that we serve because we aren't, preparing our team members to adequately to be in that environment. And then, somebody I think used the term unpacking, right? Like they're not unpacking their own history. They haven't addressed their own story. And so we just have to be really mindful that we're not just creating more trauma, because it's just people taking care of children. It's a lot more than just showing up and caring for a child.
Thank you, Shannon. Freda, how do you see the things that you will change moving forward?
Well, as a organization, for us, it's finding ways to work even more collaboratively with other organizations and social service providers in Spokane, because we've all identified that mental health, there are gaps in mental health services for our children and for our families. It's how do we come together as a community, because one organization cannot take on that by itself. And I think as a community and as social service agencies and providers, we need to continue to come to the table to find solutions for children and families in our communities. I think that's the biggest for me, is how do we do this work collaboratively? How do we pool all of our resources? Because everyone knows that people who work in nonprofit social services agencies are not here because, financial gain is clearly our motivation. So we need to learn that we as organizations need to be working together to find solutions to the issues in our community. That's the biggest thing for me, is that working with families, we know we've identified that there are gaps in mental health services. Now, what are we going to do about it as a community? Not as one agency, not as one person, but what are we going to do as a community to be there for our kids? And like Toni said, when they are starting to unpack everything that has happened in the last 15 to 20 months or so. We're going to have to be there as a community, not as just one agency, but as a community as a whole to help. So that's my take on it.
Thank you, Freda. Joel, how about you? Anything that you see moving differently?
Well, I would say two things. One, it clearly, where policymakers, our state legislature at the federal level, or members of Congress, I mean, there is a clear understanding of the need for high quality, affordable childcare. And as a result of that, in our state, we passed something called the Fair Start for Kids Act. It did a number of things. It capped copays at $115 a month for families. It allowed student parents to access childcare without additional work activities. It put money in the hands of childcare providers through increased subsidy rates, and it expanded our preschool program, ECEAP. So there were some pretty significant investments in the at our state level from the Fair Start for Kids Act. Many of them are going online now, starting first in July. October 1st, there's some changes on income eligibility for Working Connections childcare. And then I would say at the federal level, President Biden and congressional leaders are looking at making fairly significant investments in early learning. Starting first with Headstart, what you might find interesting is the initial markups in appropriations for Headstart have been focused mainly on early Headstart expansion, so birth to 3. So there is a proposed increase of over $1 billion for Headstart. $750 million of that is slated for birth to 3. But in addition to that, and probably larger, is the Senate Budget Reconciliation Package, American Families Plan, which you might have heard of, that's being worked on in the Senate. It'll likely pass, if it does, in a partisan vote of 51 to 50, with the vice president breaking the tie. But it looks to increase early learning spending by $500 billion over 10 years. And that doesn't include the child tax credits. That's purely childcare, expansion of state-funded early learning programs, money for public schools to provide early learning. And so that'll likely be taken up after the August recess. So that's one strand. The other strand I want to touch on really quickly is that I think that the movement for racial justice and equity gained some wind from the George Floyd situation. And I would say, as organizations, particularly myself as a white man, leading an organization that is primarily made up of people of color, about 2/3 of the children that are served by our state-funded preschool program and Headstart are children of color. I think groups like, I can only speak for myself, but I think other groups as well are really thinking and adjusting about how they look at the work of race, how they embed equity, and how we can, as white allies and champions of justice, change the way that we operate and really lean in heavily on this area. And I think you're going to start seeing more and more. And I think that was a pretty dramatic change. Some of it is impacted certainly by the COVID pandemic, as other speakers have mentioned, that it disproportionately impacted populations that all of us serve. But I would say now it's incumbent upon particularly white-led organizations to not just talk about race and equity, but to actually do something about it, to be on the front lines, to change the way that their organizations think about these issues. I don't think you can be an advocate for high-quality early learning without putting racial justice at the top of your advocacy list. So those are the two areas that affordable childcare and the investments, but also race equity and justice.
Thank you, Joel. Toni, I have a little bit of a different, yes, Freda. Toni, I have a little bit of a different question for you, and that's, do you have any advice or ideas for things parents and caregivers can implement at home to begin establishing some normalcy and recovering from trauma? What recommendations or ideas might you have?
Well, I have ideas, but I mean, we don't have a mechanism at this time. I mean, part of the isolation is, in our communities, we do cultural events, we do family events. That has stopped for 15 months. We don't have a way to be together to share strengths, to share challenges, to give advice. But I'm going to backtrack to what Joel said. I just really applaud you saying that. What we say around here at Native Project is everyone wants to be a warrior until it's time to do warrior stuff. And warrior stuff is equity. And, it's nice to have it on your website, and no offense, land acknowledgements and that, but you take a look at the landscape of this community, and we are all responsible to make sure Black, Native, Latinx, other kids of color have access. And right now, we are going to die in a generation without support today. And when we look at all the COVID funding that's coming into this community, the relief funding, we are responsible to make sure that it's directed to the children and the families, and especially those children and families who have been so disproportionately affected. And the last thing I'll say, and I'm off of your question, Jeanette, but being on the governor's committee, reading hundreds and probably thousands of pages of stuff, I do think the three blessings of COVID are going to be a push for universal health care. I mean, that covers both behavioral health and medical. It's going to be childcare as part of the infrastructure of this country, both for business, for everybody. I mean, it's going to be like, you get your utility bill, your water bill, you're going to get your child care bill. It's got to be part of who we are and how we pay for it. And the last is equity is actually going to finally happen 527 years later of the first colonizers coming here. It has to be done. Those three things have to be done. When we have that infrastructure, then we'll be able to help the families and our clients and our patients in a better way. So, and that's what Grandma has to say today.
Oh, thank you, Toni. And I appreciate your comment, the infrastructure, because infrastructure is more than just bridges and buildings. It truly is. Okay, so I want to keep moving and so appreciate all of this rich conversation. We have a couple of questions. So I'm going to let you all jump in and respond to these questions as they come up. So feel free to add your ideas whenever you're ready. So we have one of our participants asking, with the life disruptions we have all experienced, how can we get youth in the community back on track with their education? Is there anything we can do to re-engage the many teens and young adults that have dropped out of the education system during the pandemic?
I think we reimagine, we make it relevant to them. I mean, I think this other blessing is that education is going to look different. If you've looked at the screen for thousands of hours, again, in first grade or as a junior in high school, your view and how you learn is going to look different. And I'm not a social scientist or a researcher, but don't make us go back to how we were before. It's not going to happen. The genie's out of the bottle. Something different's got to happen.
Anybody else? Thank you, Toni.
You mind if I address that really quickly?
Please go right ahead.
I think, we finally were able to make it easier for student parents to access childcare. And so now we're at a place that if a family decides to attend, let's say, Spokane Community College and go for their associate degree, if they go full-time now, that'll count as their work activity for childcare. So they'll get that as they travel to the school, their study time, their time there. I would say one of the big mistakes I've seen in terms of the push for people to go to college is that people who aren't familiar and don't have the lived experience often think it's only about access. And often what will happen is then you get down to these conversations about free college and Pell Grants and things like that. Those are critically important. But what people, I think, forget about is a lot of people could benefit from childcare. People need stable housing. People need food to eat. There are a lot of college students, that meal plan isn't enough to be able to help them get through. And I think the COVID pandemic has made things harder. I think for LGBTQ plus families, I think some of them had to move home and weren't able to be on campus and had to deal with parents that were not as open to supporting their kids. So I think there was a lot of homelessness, housing instability. So one of the things I would say about getting more people engaged in school is that it's not simply the cost of attending, it's the other social supports that need to be in place to make sure people are successful, including mentoring and coaching that I know Headstart and ECEAP programs do very well. And I'd also make a pitch again for AmeriCorps, Serve Washington Commission. And right now they're under enrolled. It's not hard. It's not easy, I would say, to encourage people to take on a year of service for very little money and resources. But I find that it's a really good stepping stone for people to get back into school and to get professional development and support, and also to do something great for their community. So I'm a big fan of the AmeriCorps program as somebody who had served, and it got me into Headstart advocacy and the work that I did. So I always encourage people to look at that. So those are the two things. I think there needs to be more human basic needs support and coaching for students, and as well as other opportunities like AmeriCorps, but also apprenticeships and trades that we should be encouraging students to look at.
Yeah, I agree. Okay, I've got another question here, so please feel free to chime in on this one too. Often well-child checks with pediatricians and primary care providers end up being the first and sometimes the only safe option for children to be able to address mental health problems and trauma. What kind of role do you think healthcare providers can play in trauma-informed care, especially with the pandemic where access to these appointments have decreased and fallen behind? What do you think can be done as a community?
I think you create more access. I mean, I always bug Freda about having a clinic over at East Central. And again, if I'm the only healthcare provider of color in Spokane County, that we need access points everywhere and demystify the whole medical process and not being owned by corporations, and have it at Headstart, have it at East Central, have it in community centers. I think our medical providers do a good job at screening, but I honestly think our healthcare workers and teachers do a better job of screening because they spend every day with that kid. Mm-hmm. But our insurance companies and our Medicaid, it's when that provider makes the referral or the authorization is when the kid actually gets help. So like Freda said before, our systems have to work together, be more low barrier. And if a parent or a grandparent says, this kid is in trouble, he needs help, I've seen 10 calls made by the behaviorist or the doctor to get that kid help. That's wrong. That's not help. That is not help for that kid. So we got to figure that out. And Freda has to do a clinic.
I hear you, Toni. I promise I'm on it. I'm trying. I agree with you that there needs to be better access as well. And also to services that are culturally relevant. That's kind of what we're seeing. Just not, because like Toni said, we've seen parents who refer but someone has made 10 calls on their behalf and they're still where they were a week ago. Because our systems are not really designed to be collaborative and, I would say, easily accessible in a way that they need to be for our families who have already so much going on. If I got to catch 3 or 4 buses to access mental health services, it's probably not going to happen. But if I'm visiting community centers, or if I have kids in early learning programs or after school programs or other youth development programs, that place is a resource for me. I'm more likely to access the services if I'm already entrusted, or people that are working with my children every day, and as well as me, I trust. Why am I going to get on the bus 3 or 4 buses during the day to go access services where people don't even know who I am as a person? We've seen it happen too many times when we have social workers who are doing the follow-up once a referral has been made, and how there's been that breakdown between families accessing that service and the referral that was made. Parents are not engaged in that way if we're continually putting barriers in front of them. Our goal is to break down those barriers, to provide as many services as we can in one area for those parents that already have trouble accessing services, whether it be transportation, working 8 hours a day and still having to get on the bus once your workday ends. So how do we make sure that we are not creating barriers? Because I've seen us do that so many times and not provide enough access. I'm going to give an example, and I've already had this discussion with Chad, so we worked it out. So there is a clinic 2 miles away from the MLK Center. But if you don't have transportation, you have to get on 2 different buses to access that clinic. And it may take you 45 minutes to go 2 miles. If you are 70 years old, that is not happening. It's not happening. And I'm like, transportation is an issue, and when we are making sure that services are accessible, we actually need to talk to the folks that are going to access them, for sure. Because no one thought, okay, well, it's close, it's right here in this neighborhood, but only 2 miles away. But if I'm 70, I'm not walking 2 miles. It's not going to happen. If I have 4 children with me, I'm not walking 2 miles. So then I have to rely on public transportation that's going to take me from this destination here at the center all the way downtown. Then I'm going to have to get on another bus and come back. That's crazy. People are saying that just doesn't work for them. That's my little tangent for the day. Like, how is it that people are having trouble accessing services that are 2 miles away?
Yeah. Thank you, Freda. So, wow, I really appreciate all the questions that have come in, but we're not going to have time to answer any more of them, but we'll be gathering them together, and we're going to read through them after the event and see if we can get some more feedback. So as we start to bring the event to a close, I'd like to ask each of the panelists to give their key takeaway from this conversation. What are the things we can leave today that help us pave a path forward in our community? So Shannon, I haven't heard from you recently, so I'm gonna start with you.
Thanks. Yeah, I'm just going to reiterate, if not me, then who? That's kind of the motto that we live by in our YWCA ECEAP. So, and it's that meaningful access. It's the soft handoff. It's not just like, here's the number, good luck, like Freda kind of just emphasized with her story. And then those mobile services, that those services can come to us. That was something we worked endlessly and did not get very far on this year, was how do we get those mental health providers to come here in this environment that kids already are connected, set up, and they're in a trusted environment to provide that one-on-one support or that support that they can get in a group environment. It's just not something that our community readily has access to. So that's kind of my takeaway. And then continuing to make sure that we're taking care of, the team members, the employees that are serving our children and our families also, because they are, the children and families of our community equally.
Thank you. Joel, how about you?
Well, I would say a couple of things. I mean, first of all, I just want to thank you, thank everyone out there for listening to this panel and joining this conversation. I really appreciate that. And I really consider you guys heroes. As part of this pandemic, you really should be celebrated. But celebration is one thing. You need to be paid. And we need to make sure that there are real dollars that are coming in, not just for early learning, but for folks that are serving families that are furthest away from opportunity across the full line. So I'd say that's the first thing. And in order for that to happen, it's going to mean that we're going to need to educate, organize, and mobilize. I'm the advocate on this panel. I realize that. The country is divided, and I know it's divided even. I know I'm at a panel in Spokane, and I'm speaking to you from the western part of the state. I saw the Capitol hearings. I don't know if some of you did, with the police officers, the Capitol police officers, talking about what happened on January 6th. And the country is certainly divided. But I would say to you, if you'd like to see more resources for families, if you want to see staff get paid and be treated with fairness and decency and have universal health care and have transportation, we need to do all we can to make sure that we're engaging with lawmakers, that we're involved in the electoral political system, that we're helping people speak up. I think that's critically important. One of the mentors that I used to work with used to say, and I think it's even true in this environment, if you don't do politics, politics will do you. And we need to make sure that we thank those like Senator Billig, who was the majority leader, who really went to bat for not just early learning, but for children's issues. And we hold lawmakers accountable that didn't. And I know that I'm leaving you guys a little bit with that, but I just wanted to say that if we're going to make sure that the families that we care about the most and the people who do the caring get the support and help they need, we need to mobilize. We need to get organized. We need to be involved. And so I thank you very much for inviting me to participate on this panel. And I'm really appreciative of the work of the Y in Spokane. And again, I thank all of you for joining us today. I really appreciate it.
Thank you, Joel. Toni, what are some of your key takeaways?
Well, I think I prematurely listed them, but I just think for me in this community is to not be afraid. That's the key thing. To not be afraid is a spiritual calling, is to model what we want for our children and our families. Someone asked a question, I think in the chat, about the COVID vaccines coming up. I am not afraid to be a business that requires all of my employees and contractors to be vaccinated to come in here. And that's the kind of modeling we have to do, to not be afraid and to get well. I do think that we have been welcoming the immigrants for 529 years here. So things really, this split country has not really been split for us this whole time. We know that this is our country and our land and our resources and our people to protect. And we will continue to do that, whether they're R's or D's. It's very interesting when the police at the Capitol get treated like our community gets treated in Spokane all the time, being hit over the head. And so I think that's the great equalizer here, to realize, what do we want? we want to be unafraid for the future? Do we want equity? Do we really? I never let my kids say the Pledge of Allegiance until it's true. Till we are all created equal. I would not let them do it. And we are not equal now. And as we move forward, we have to be. We have to be. As a mother of 10 grandchildren, I know I'm not going to see equity or universal health care or universal child care in my lifetime, but I am not going to be afraid to keep saying it. And we all have to make sure that that happens. And Freda has her health clinic over at East Central.
Thank you, Toni. I so appreciate that. Freda, how's that healthcare clinic coming?
Right now, it's just a dream, but you know, that's how they all start, right? And it's going to happen. But I think my key takeaway is that there are so many amazing people in this community listening to this discussion, asking questions that let us know that we're stronger in numbers. We have some amazing leaders in our community, and we just need to continue to collaborate and work together. And like Joel said, make sure we are mobilized, make sure that we're supporting the work and supporting the people that are doing it. We're supporting staff that's on the front lines every day, because it's so hard for us sometimes as policymakers, administrators, to say what we think is going on, but we're not the ones on the front lines every day. So listen to the people that are actually doing the work, value their perspective. We don't know it all as leaders. It takes all of us working together to address issues in our community. So I just would like to say my biggest takeaway is that we are stronger in numbers. We're stronger as a community as a whole. And so many people, like I said, are listening to this panel who are doing the work, who are just amazing community leaders. So I applaud you as well for listening, for participating, for asking thoughtful questions, and let's continue to work together on behalf of our community as a whole, and especially for our children and so many other vulnerable people in our community.
Thank you. You know, I'm really inspired, and I'm so grateful for each one of you participating in this panel. So much kindness and thoughtfulness. I really appreciate your being willing to participate and be vulnerable and share your ideas. So this has been a recorded session, and it will be shared with all of the registrants via email next week. And we'll be sharing it on our social media channels as well. And if you found it valuable, please consider sharing it with others. Again, I want to thank each one of the panelists. Just such a rich discussion. Thank you for all of our partners and supporters and everyone who participated in questions and in the chat. And we just want you to know that we couldn't do this without you. So thank you for joining us, and have a great rest of your day.